Are we on? Hello, can everyone hear us? Say hi if you can hear us, so we know it's working.
It's working my end.
Just wait for people to say hi to make sure they're actually online. Says we're live. Oh, we've got Lauren.
Hi, Lauren.
Anybody else?
You look like you're in an office, Jade.
No, just my conservatory.
Very professional.
Got my glasses on. In my pyjamas though, not that professional.
I was until about 20 minutes ago.
Right, okay, people are starting to join.
Fabulous.
Deli, Shannon, Lindsay, Megan. Just wait for a few more and then we'll...
Super duper. Quick, because my eyelashes will start falling off.
Right, okay, we've got a few. So hi
Super.
everyone. So this is the live Q&A with midwife Katie Adams. You might know her from our local scan clinic, See Your Baby. She's been a midwife for how long, Katie?
Oh, far too long. My goodness, coming up for about 18 years now, 17, 18 years.
So she's very experienced, so if you do have any questions, pop them in the comment box and I'll ask her. We might not have a chance to get through them all, but whatever she doesn't answer live, she'll comment back to you or send you a private message if you prefer. So I'm just going to go ahead and read out the questions that got asked in the group. So we've got an anonymous question. Said, I'm so worried about my mental health. It's not the best at the moment anyway, and I feel so anxious throughout all of this. Will the support still be there with every staff member being preoccupied with the COVID?
I think one thing that we've all got to accept, whether having pre-existing mental health conditions or not, fear and anxiety is something that we all expect at some point during our lives. It's a normal standard process of being a human being. And especially when we're faced with sort of scenarios at the moment where we don't know what's going to be happening from one week to the next. Some people are totally unable to contemplate with the idea of not knowing what's going to happen in their routine next week or the week after or the week after that. We've got to appreciate that looking at the science and statistics of things, that 1 in 10 women that go on to have a family experience some aspects of mental health concern during their journey. We also know that ladies that have pre-existing mental health scenarios may be at higher risk during their pregnancy, during and after. It doesn't mean because the NHS is trying to, I suppose, still care for our maternity patients and everybody else with the same compassion that they had before, but also manage this COVID-19 as professionally and safely as possible. It doesn't mean that they're going to prioritise the COVID-19 ahead of the safety of our maternity clients and their needs. Now, generally what happens when people book a pregnancy is that their midwife will ask them questions about pre-existing mental health conditions, and it's during that meeting that generally we can start the ball rolling with necessarily referrals or support groups or increased visits or telephone calls to be able to support you. However, some people might not know that they have concerns at the beginning, and then this starts to happen a little bit later on. It's all about acknowledgement. And I think at this stage, if you can be honest with yourself that things are not working so well, then we have to alert support, whether that be from your friends or family, or whether that be from a professional such as a midwife if you're expecting, so we can ensure that we get you the help that you may very well need. Now, thinking in this day and age, or present week, should I say, with all what's been going on, people are worried about the access to their midwife, their access to telephone conversations, their access to support groups, their access to the friends and family, because they're not seeing them because they're being told to stay at home. We can still connect. connect, and connecting is still very important, whether that be by telephone, whether that be by Facebook, whether that be by this fantastic group that you've set up, Jade, where everybody can collaborate as a community, get together, that seems to be in this very similar rocking boat, and we're not quite sure what island we're going to visit just yet. So all I can say to people is, remember, there is some essential factors to keeping your mental health safe, and that is routine. Yes, it's difficult at the moment because everybody's routine has been completely tipped over. However, if we can start to establish that again, the better. Sleep. It's imperative that we get at least 8 hours here and there
before
of
the baby
good
comes.
sleep. It's not easy, is it, when you've just had a baby or you've got a huge 9-month bump that's about ready to burst and you can't get comfortable at all. So I would recommending a meditation or some kind of sleep therapy or accessing apps. I found a fab one and I did write it down. Where on earth is it? Honest Guys Great is a sleep meditation program. That's online. You can access it and it's free at the moment. Embrace How to Relax as well as be active. Now, that's their ethos. We'll also think about keeping active. So I've just started. I mean, I'm only 20 weeks pregnant, so I'm halfway through my pregnancy now. But I mentioned to you earlier, Jade, about I haven't had the circumstance of feeling as though my mental health throughout my life has been, well, I've had some knocks and I've had some toughs, but I haven't had the challenging experiences where I have had to seek help. But I have woken up on a few mornings over the past week and thought, well, what's the point of getting up this morning? What is the point? I may as well stay in bed. I have to get myself, yeah.
Nobody's alone. I feel like it. I'm normally happy, jolly, I have my odd days like we all do. But this past week, I've just been going down and down every day. And I posted in the group earlier, just so people know, it's completely normal. I had a wobble yesterday. I cried a lot, but I spoke about it and I feel better today. And that's what this group's for. We're all in the same boat. Most are pregnant or just had babies. Your emotions are all over the place anyway when you're pregnant or just give a birth, but with all this going on as well. So use this group. Don't be ashamed. It's nothing to be ashamed about. And we're all here to help.
Of course, yeah. And that also goes for, I suppose, for friends and families that are out there as well, that know somebody that they're expecting. Maybe you've got a friend that's having a baby. Maybe you've got a friend that's had a baby. Maybe you haven't seen them for quite a long time. Maybe it might be the right time just to send them a message and ask them if everything's okay. Even if they have a husband, 3 other children, and they seem to be getting on really well. Sometimes it's the distraction away from normal life that you can then accept that you're at your brink and you probably need a little bit of support. So I would say to anybody, I know we've spoken a little bit now about mental health and how to be able to cope. If anybody's having any concerns with their mental health and they don't know what to do, they can't reach out to their friends and family and they really do feel as though they need some extra support, you have your midwife. If you're having difficulty accessing your midwife, you have your GP. I know I can even hear people in Little Thorpe now screaming at me, GP, are you joking? I can't get through, to speak to my GP about a repeat prescription, let alone about something new. Keep trying. You can get through, you can speak to somebody. It doesn't mean just because we've got the COVID-19 going on at the moment that there aren't other things going on. There aren't other people that are experiencing other medical conditions and are other concerns that need to access. We still need that support. We've also got online Facebook groups. We've got mind.org.uk, we've got Every Mind Matters, we've got NHS programmes, we've got, let me see if I've got some here, Headspace, Calm and Worry Free. Now don't forget, if you are really, really struggling, then there are other emergency lines if you do need. The Samaritans can be contacted on 116123. That's if you need to speak to somebody. Everybody relates the Samaritans as almost an only way out sort of topic, where you feel maybe you relate people only ringing the Samaritans when things are really, really desperate. That isn't the case. There's somebody on the end of the phone there that's a trained counsellor that can be able to talk through everyday issues that you may very well have. We've also got text shout. This is a great thing. And it's on 85258. Now, this is a texting service. Okay, yes, you need a mobile telephone, and you basically just text from your mobile. When you're ready, shout, and then somebody will contact you back. It doesn't use your credit, and it means then that you get, once again, a trained counsellor that comes back to you. If you also want to just seek resources online, the Pandas charity, as I've just mentioned, mind.org.uk, also have lots and lots of information with relation to the COVID and perinatal mental health, specifically to ladies that are pregnant or have just had babies. You're not alone, and we are there for you. And by all means, if anybody's got any more burning questions related to mental health, then please do send them privately. You can send them anonymously, and I will seek you resources, and I will seek you help. So please don't panic. Let's get our heads together and let's support each other.
Perfect. I think you covered everything there. And yeah, so if anyone is struggling with anything, either myself or Katie, private messages will be able to put you in touch with the relevant people and help you. Don't suffer alone, basically. Right, so the next question, another anonymous. I really want to breastfeed my baby when he's born, but I won't be able to attend the local breastfeeding camp, and I don't want to stay in hospital longer than I have to for the support. So what do I do if I can't do it?
Okay, so generally what happens is you go in to have your baby, you'll have spoken to your midwife, your friends, your partner about your methods of feeding your baby. You make an informed decision. Some people haven't made a decision when they go into hospital, and they're a little bit, well, I might give it a go. With breastfeeding, if it doesn't work, then I'm quite flexible, and some people are quite certain that they want to breastfeed their baby. So it can be a grey area before you go into hospital, and some people have made the decision of definitely what they want to give a go. Breastfeeding is well supported amongst the NHS, and many hospitals are now baby friendly initiative. So we have a scheme, an organisation within the hospital that is well supported to provide women with the support they need. Now, purely because of the COVID-19 that's going on at the moment, women probably feel a little bit anxious about spending longer in hospital than what they probably would have done prior. Don't forget that hospitals are putting down huge measures to protect themselves and also yourself, your baby, and your partner or your birthing partner when they come into hospital with you to have your baby. That will not stop throughout your whole stay. Women will be encouraged when the time is right to return home. That should include when the baby is warm and regulating its temperature. That will be when the lady herself is able to mobilise. That will be when her bleeding is well controlled, and that's also when she's feeding her baby successfully. Because the dangers are that we send women home 6 hours after a birth because she's desperate to get home and desperate to breastfeed her baby and hasn't initiated feeding yet. That in itself is problematic. And what does it cause? Babies that don't feed, a very depressed, tired mummy, and then a reintroduction back into the hospital service again because the baby isn't gaining weight. So it's a whirlwind of concern where we need to get this right from the very, very beginning. Listen to all of the support before you go into hospital about initiating your feed. Immediate skin to skin, great. If possible and where possible. We try to have, where possible, uninterrupted skin-to-skin contact with the neonate for at least an hour. We're encouraging a feed as quickly as possible when the baby and the mum are ready. Once we initiate that feed, the more successful this is going to be, I assure you. Support from your partner and also support from your midwife that's looking after you is really, really important if you haven't breastfed before and this is a new journey for you. Now, don't forget, if you do go home, forget the COVID-19 because it does happen. You do go home. I've been there, and A to B met at the first meet, A to B met at the second meet just prior to your discharge. You get home and it all goes rock bottom. Did it happen?
Mm-hmm.
It happened happened to me, it happened to Jade, and the chances are it probably happened to lots of other women and will continue to happen amongst the community of postnatal ladies. So make sure that if you can and where you can, we have a plan that rhymes. You have access to your maternity, so when you leave hospital, you will be given a list of numbers for emergency resources. So whether you need emergency access, this is where you need to ring, and these are the reasons why. If you have questions or information that you need to ask about your feeding, this is where you need to go. And this is the information that you need and your midwife will give you when you leave hospital. You're not going to literally be hung out to dry. You will be given these support mechanisms when you leave, but they're an enormous amount more, and even ones that are even more accessible, because yes, your midwife is covering a huge amount of people, and she will obviously support you absolutely 100% as quickly as she can do, but as always, you might not get through straight away. And when your baby's screaming and your baby needs to cry, or you've got a concern because your nipples feel like they're hanging on by a thread, you need support now, okay? So there are lots and lots of other community resources, great organisations. I've looked at the majority of them. Most of them have Facebook networks. Most of them have telephone numbers. Most of them have direct access, websites, and also emails. So you might feel beneficial contacting these groups before this process of feeding even starts. They will discuss with you lots of different topics about supporting the initiation of your how to improve your experience, how to sustain your experience, and also discuss about topics that are not so popular, like antenatal hand expressing, about getting milk off prior to your birth, from a certain gestation, safely of course, with the support of people that know what they're doing. It's an option. A lot of people don't know about it. A lot of people will want more information. I'm here to ask if you feel as though you want to know more about certain topics. That just goes off onto a different whirlwind. Support groups such as Charmwood Bras. So Charmwood Bras is a huge company that have lots of supportive volunteers that dedicate themselves to providing breastfeeding support. We've also got bosom babies. I was going to say bosom buddies then. There is a bosom buddies, but it's not concentrated to the Midlands. So bosom babies is a big organisation, but it has lots of different sectors to it. So I have one locally to me which covers my area of Littlethorpe and Wigston and various other areas, and there is another company, another department to the organisation that covers maybe North Leicester, Central Leicester, etc. So they're more bespoke to your area. They all sing from the same hymn sheet, they all give exactly the same advice, but it's just bespoken to somebody that lives a little bit more local to you. Great support groups. One that's been going for many, many years is also the Lillesh League. You can contact them through their organisation. Some of the issues that some ladies are having is that their antenatal classes have been cancelled, and it's usually at this point that you feel as though you gather as much support as you can about infant feeding to build your informed choice. Because a lot of the classes have been cancelled, you can access them online. There's lots of places that are doing them online. There's lots of places that you can access, as I just mentioned, privately to be able to build up your information about breastfeeding. And there is still the access to your midwife. So you still will be able to talk to her about feeding. You will still be able to talk to her about your choices. But I would strongly suggest, if it's something that you really, really wanted to do, then have a chat with some of these support groups before you even get started and see whether they have some really constructive ways about how to build your confidence before the wheel of the birth motion has even started.
I will post a list of all the people that Katie just mentioned as well, just so you've got access to their websites, numbers, everything. So I'll get a list together and post that at some point tomorrow. I'm also in talks with some of these people, and I'm looking to do a either live or pre-recorded breastfeeding class. Also, we've got a live antenatal class on Sunday at 12:30, and she will be talking about breastfeeding as well. So there's lots to come in relation to breastfeeding and any other questions. A lot of the mums in here are already mums as well as being pregnant. There is somebody in the group as well that was happy to give advice. There's a few people that want to join that are breastfeeding peers that have asked me if they could join. So if everybody's happy with that, then I'll get them to join as well if you've got any questions. But yeah, I will get that together.
I think that's the one thing, isn't it, that sometimes when you're going through a moment that is so totally new to you, and you have somebody that's offering some support that has been through it themselves, take it with both hands and grasp it, and enjoy every experience that everybody's had, and relish from it. Because I have had 3 children, expecting my 4th, and had 3 fantastic breastfeeding experiences. I know that isn't for everybody, and my advice wouldn't be perfect for somebody else, but somebody else, it may be absolutely wonderful for. So yeah, reach out to everybody and get whatever you can. It's free.
That's it. And people have so many different experiences as well. Like, obviously I talk to my clients about breastfeeding all the time, and we're totally different. I mean, I really struggled, and one advice I would say is St Mary's, Melton Mowbray. If it wasn't for them, I wouldn't have breastfed. And you can go for breastfeeding support even if you don't give birth there. So I went back there after being at the Leicester General, and I stayed there for about 4 days because I was so scared to go home. But if it wasn't for them, and they literally, bless her, she had my boob in her hand and like literally milking me, and I didn't think I would ever let anybody do that, but I was just like, just do it, I need help. And they were brilliant. So the support is there.
How long did you feed Martha for?
About 9 weeks. It wasn't that long, but because I can't be fed straight away because of going back to work, I went back to work when she was 5 days old, so I had no choice but to obviously give her a bottle straight away, and she got too used to it, but still managed about 9 weeks. But I really struggled, and I had to use nipple shields because she just wouldn't do it, and my nipples were so sore, and I won't go into the gory detail to scare anybody. But we've all been through it, and it's lovely if you can do that and have that bonding experience with your baby. But there's loads of support there. So any other questions about breastfeeding, just ask and we can talk more into that.
Super.
Right, so the next question, another anonymous. I'm due to have a C-section in 9 weeks, as following a complication with the coil after the birth of my first, I'm at risk of uterine rupture. Is there anything I can do pre or post-op to speed up recovery? I'm anxious about spending a long time in hospital, as I also have a 3-year-old son. Okay.
Once again, I'll bring the COVID-19 in shortly, but usually when we have a pre-planned caesarean section, there are certain measures that the hospital will put in place prior to you going into hospital to prioritise your safety. The focus is, throughout this whole process, is a happy baby and a happy mummy. And that would be to have you come in for your surgery, your baby is delivered, and you go home when mum and baby are well enough and it is safe enough to say you can. Now, usually if it's a pre-planned scenario, we would like to say that in a more controlled environment, the chances of there being a more advantageous scenario through a pre-planned caesarean as opposed to an emergency caesarean, I'm not talking about normal birth, a pre-planned caesarean to an emergency caesarean, you're probably going to get a more secure outcome with the pre-planned than the emergencies. Okay. Now, because we can put these things in place, you can have an anaesthetic review before, you can receive all the advice about visiting, you can receive all the information about taking your medication prior and whether you're allowed to eat and whether you're allowed to drink and whether you need to shave and whether you need to do this. There's all sorts of information that you get. So that will still be in place, and you will still meet and greet the team that are going to be looking after you and the ones that want to see this outcome as successful as possible. I'm aware that day and age, years ago, section, even elective, you would be in hospital potentially 7 days. This is very different, and generally there is no reason why 24 hours after, or slightly more, that we can think about discharging you and sending you home. There are some vaginal deliveries that stay a little bit long. Seems a bit of a shock, my God. Elective caesarean section is still quite a dramatic procedure, and these ladies are going home 24 hours later. There are some things that you need to be doing prior to allowing your discharge to take place. That would be your mobility needs to be back. You and your baby need to be healthy and well. You need to have gone to the toilet for a wee. Your pain needs to be well controlled. Your bleeding needs to be well controlled. Your baby needs to be feeding. Your baby needs to be warm. There needs to be any prescribed drugs disseminated, so you've got your medication to take home with you. There's lots and lots. The womb needs to be. There's lots of things that we take into consideration. But there is a high percentage of ladies that do go home within that first 24 hours. Now, I know that you're speaking of issues relating to the coil and their potential of there being a rupture. Now, specifically with this lady, the reason for the planned caesarean section is to not trial labour, because there is potential of the uterus having a hole in it and rupturing. We don't want to go there. So we're planning for this baby to come a little bit earlier, where there are no experiences of any contractions, and the uterus is then not going to rupture with prior to a caesarean section unless labour starts. So that is the reason why this lady is going. But other than that, she hasn't mentioned any other concerns that potentially may impact her after birth. There is the general things that that caesarean section births can increase your bleeding, so that will be monitored. I have discussed that. Her pain, she may have some pain. I have discussed that, it's one of the things that we monitor. So prior to, listen to your advice that you're given. Make sure that you and your partner are well. Self-isolating at this stage prior to going into hospital at that gestation is crucial. I wouldn't imagine that prior to your caesarean section that you're going to be at work. I would probably advise a couple of weeks, so 36 weeks, if you are at work, try and have a chat with your manager with regards to maybe maintaining, especially those in the third trimester, to maintaining your workload at home if it is necessary. And that is the guidance from the RCOG. Ladies in the third trimester are recommended to be at home self-isolating, and that's for a good reason. For those that are about to give pending birth over the next few weeks and you want to be fit and well, you probably will have self-isolated yourself without listening to the other governmental advice, because you're wanting to do the right thing. Your partner, if you have a partner that's going to be coming into the surgery with you, make sure that they do the same thing, because we want a fit, well, healthy daddy. If that doesn't work and unfortunately he becomes unwell, then you may have to consider a substitute to go into the surgery with you. Now, it's a very, very tricky time for us to sort of stay safe as much as we can, but you can only do what you can do. Remember, going back to what we were talking about earlier about fear and anxiety, it's a normal behavioural response for people to be frightened, especially those that are coming up to having their baby at this really, really vulnerable time. You cannot help what is going to happen, but you can put the stepping stones in place to try and stay safe as much as possible. So that's a real big thing for you, is make sure that you stay safe and that you don't become unwell, or put yourself in situations where potentially you or your partner or your family that's isolating at home can become unwell, because that really would prolong your stay. And when you've had your baby, be guided by the staff that are looking after you, and I'm sure that you will get home as quickly as possible.
Right, that was obviously anonymous, but I hope that helps you, whoever asked that question. So a few people and somebody in the comments have just asked as well, just about their checkup scans at the hospitals. So obviously they can't have their partners in with them at the moment, and some aren't allowing them to FaceTime. People are worried, what if something is wrong with the baby and they have to find out alone? What are they doing about the genders? Are they going to write it down so they can find out together? I mean, I know you're not an NHS midwife at the moment, but do you have any insight on that, or do they just need to ask?
Yeah, what I try to do is follow as many of the trusts as possible with what their current guidance is at the moment. And I'll be honest with you, the majority of them are all saying very similar things. There's a few little changes here and there. I'll concentrate on the ones around the Midlands. Doesn't mean that outside of the Midlands are really doing a great job. Suggest the first thing that you need to do is try not to listen to speculation, because I have seen the most bizarre scenarios that have been spread, or the media that has taken a story and completely blown it out of proportion, and the headlines have been read and the real nitty-gritty of the story has not really been consumed, and it's been assumed and spread, and then Alice, that lives down the road, that's 38 weeks pregnant and has just started having mild contractions, has just been told that partners are not allowed to go in to hospitals. Well, you can imagine what's going to happen to your adrenaline and also to your love hormones, that you need to be able to get yourself into labour. Your contractions are going to do that. So remember, local hospitals are going along with the plan, and I'll go through it and the reasons why. Scanning. Now, most ladies will be invited for a 12-week scan and then again for an anonymous scan. There'll be some ladies that have already mentioned about having low PAP-A or having growth scans throughout their pregnancy. The concern is, will my scan still be going ahead? It is very, very challenging for me as an outside person to say your scans will still be going ahead. But the word of advice that I'm giving is, if your scan isn't going to go ahead, you will be informed. Don't worry about the scan that's meant to be coming in 4 weeks' time. Is it going ahead or not? Because once again, fear and anxiety sets in, and there's nothing that you can do about it at this present time. And you have 4 weeks panicking. So when these the way that they've been contacting people is by telephone, or they may be contacting by letter, just to inform you that scans have been deferred or they have been cancelled. Yes, it is really, really frustrating. Yes, the hospitals are doing everything they can to prioritise scans at this time. What I have noticed is that when ladies go for their antenatal appointments at the hospital and when they go for their scans, if they're going ahead, that they are being requested, number one, to have their temperature taken on arrival, to use the hand sanitizer, and a very short questionnaire about, have you had a cough, have you had a temperature, have you had any respiratory concerns? Very simple questions that you can answer, and then once you've answered them, then you'll be led into the main unit. You are asked to attend alone. That in itself is the most frustrating thing for many, because it may be the first time that you and your partner are going to see, or your friend or relative that's going along with you to the scan, the first time that you're going to see your baby. This is done purely for the very good reason of trying to reduce the spread or the risk of the spread of the virus. And limiting people in one area does that. So despite the fact that it's really frustrating and terribly challenging for partners that want to attend and ladies that want their partners to attend, that is at the moment the advice that's being given. So ladies will attend their antenatal and scan appointments to the hospital on their own. These scans, now in terms of legislation, in terms of scanning, what we're being advised to do, obviously your sonographer will be using full PPE, so protective wear, and that's even if you're fit and well. And they will also be limiting, where possible, the length of the scan. So for example, the gender at 20 weeks. Now, it may be very easy to see a gender while taking a thigh measurement during a growth scan or during an anonymous scan at the hospital. The hospital sonographers will be guided on what they can and can't do. There are certain factors that they need to get during the anonymous scan. They are priority. They need to get those things to complete the scan, which is essential. But the gender isn't. It's not always accepted that a gender would be given at a 20-week scan, but you would be informed if they can tell and if you ask. I would suggest that on arrival that are wanting to know the gender, that you ask. I am still in grey mist about whether they are able to write these down. I'm thinking about time. What we're not wanting to do is increase the sonographer's time with the patient and with their time within their frame of work. This needs to be concisely and effectively and led by experienced staff that know what they're doing, so these scans are done quickly. So in terms of gender, there may be some hospitals that are saying, there may be many that are not. I know from a private facility point of view, because of the restriction between scans, or the time limits that we're trying to adhere between scans, that we are prioritising only certain services at the moment, and that does not include 4D scanning and gender scans. Once again, it's a real, stamp on the foot in terms of expectation and what people have been looking forward to, but very frustrating. But remember, this is for essential purposes only, and if we're going to get this damn thing, then we need to be working together effectively, and understand the reasons why these measures are in place. The Royal College of Midwives and the RCOG and lots of other colleges and bodies have released statements about birth and about partners being present for the birth. There was a big article, and this is a prime example of speculation and media stories, of a lady the other day that hit the headlines because she gave birth to her child alone, her baby alone, at a hospital not within the Midlands. And actually, if you read into the story, it was because her partner was unwell, so he was suspicious of symptoms, quite rightly so, wasn't able to come into the hospital. They did the right thing, and she didn't have anybody that she felt was appropriate to come into the birth that she wanted to share. Therefore, that is the reason why that story hit the headlines, not for the fact that she was told that she couldn't have a birth partner. No woman, now this is a big statement, no woman should be birthing alone. And that is without a comforting, supportive birthing partner. And I don't just mean a midwife that you met on arrival at the hospital. So as far as it stands, all women are permitted to take a birth partner, whether that be a partner or whether that be a friend or a family member, into hospital with them. But there are very clear points that we need to get across. You need to be fit and well. Birthing partner needs to be fit well. Absence of cough, absence of temperature, absence of self-isolation, blah, blah, blah. Otherwise, unfortunately, they cannot. If you are unwell and you have signs of the COVID-19 coronavirus and you are concerned, you can call 111. You can, in an emergency, call 999. You can speak with your maternity unit. If you go into labour, then you ring your maternity unit and you let them know before you arrive that you have gone into labour and these are the circumstances. They will be able to advise you accordingly. Then, how long can my partner stay with me? Well, your partner can stay with you throughout the birthing process. And I have heard that partners are staying with ladies right up until their discharge or their transfer to the ward. Usually that takes between 2 to 4 hours. If you're going to the ward, if you're having an early discharge, which some hospitals quote as around between 4 to 6 hours, then generally he can remain, or the birthing partner can remain with you right up until you leave the hospital. Please stack the partner up with lots of food, lots of drink, fluids for yourself, food for yourself while you're in labour, because there will be none of this going in, going out and swapping of people. I'm really hungry, I'm going to go out and get myself something from the refreshment machine. It doesn't happen, and no food will be provided to the partners while you're on the labour ward. I'm quite sure of that. So take refreshments with you, take food with you, amples of it, stack up and self-isolate in your birthing room and have a wonderful birth. And then as soon as the scenario is all over, then you can weigh up your choice in hospital, or whether you fit the criteria of going home. But if you're struggling and you are panicking, then do contact your maternity unit and ask them. just don't be gone by other threads of other people telling you stories of what they've heard around here, there and everywhere. Get the information from the gold of the mouth, and then, you know, you'll not be setting yourself up to fail.
That's it. I think a lot of the time we can read media, can't we, and then assume that that's going to happen to us, and then we'll panic. And
we'll do it. And I say, and I know it's very, very difficult because we're trying to follow the media, keep ourselves updated with what's going on. Make sure that you access reliable resources. Make sure that you're reading newspapers or scientific evidence that's giving you something that's you know, gold standard research and information, and not just picked out of the air and then made to believe into something else, and then you're getting all confused. Because what we tend to do as adults, as human beings, is we get really encapsulated by the things that we don't like. So if we read something about birth partners not being allowed, and I'm 38 weeks pregnant, I bet you bottom dollar you will search the internet for 38 weeks pregnant, partner not allowed, and I think I'm going to have a heart attack. Evidence. Off we go. You will do. And why do we do it? Because we're going to shoot ourselves in the brain and drive ourselves mad. Try to steer yourself away from the negative things and think about the positive things. Think about the great things that are going to happen. And this is going to be a successful outcome. And we want a happy baby and a happy mummy.
Exactly. Right. I'm going to go on to the next question, just 'cause I'm conscious of time. So Megan asked, she's due in September for baby number 2. The midwife previously discussed the option of a C-section and said she'll get an appointment to discuss with the doctor, and she's not sure if that will still go ahead. And I think you've pretty much covered that with, unless told otherwise, assume it's going to still go ahead, and they'll be taking every precaution.
Of course. Usually we discuss the mode of delivery with a woman that is consultant-led or may have had, I mean, I'm not understanding what Megan's scenario was with her first birth. Maybe she had a cesarean section last time. Maybe there were some complications in labour, so she had to have a cesarean or an emergency, or I'm not so sure. But the midwife has mentioned to her that there is a potential or the hospital may discuss with mum a cesarean section this time round. Remember, this is a discussion between two people here, and that's Megan and her physician, so her doctor, when the time is right. And I believe if Megan is going to have her baby in September, she could be anywhere between about 16 and 20 weeks, somewhere around there. Megan will be invited for an appointment with the doctors at the hospital around about now, if she hasn't had one organised already. But generally at that meeting, it's very difficult to be able to discuss the definite mode of delivery unless there is no other option. But usually, if there are a couple of options there, then the mode of delivery is discussed generally about between 32 to 34 weeks. With the consultant, you'll have an appointment, and then they will talk about the pros and cons of mode of delivery, and then you make a decision, discuss it with the physician of what you feel would be best, and then the plans are made from there. So we still have quite a long time before the discussion of the mode of delivery is going to happen. Generally, that she hasn't attended already will be to discuss about her journey of care across the whole of her pregnancy period. So how many scans she's going to have, what the expectations are, any other supportive professionals that are going to be included in her care, and what we would like her to do, medication, etc., between now and when the baby arrives. So if she hasn't had that appointment and she's had a previous cesarean section, then discuss that with your midwife about when that's going to happen. I know that I had, going from my experience, my baby is due toward the end of August. I was referred to a consultant at the hospital, because I'm old, by the way, and I saw a lovely doctor at the Leicester General Hospital a couple of weeks ago who spoke through my plan of care. And then a couple maybe a week later, I had a telephone conversation from another doctor who rang me, and it was a wonderful service. It was over the telephone, and it was a collation of all of the things that we discussed, just to let you know that this is what we're going to do, this is what we're going to do, this is when we'll see you again, rah, 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 rah. Are you happy with it? Do you understand? Yes, I do. Is there anything else you want to ask? No, thank you very much. Job done and all finished. So I am hoping that there is some consistency along the way, and I know that these are all new, tried and tested things that the hospitals are trying to do in terms of distant appointments, but that these things are becoming consistent for most people. So we see a trend of what most people are getting: an appointment here, a telephone call here, and a scan here, and a blah, blah, blah there. So at the moment, I wouldn't worry, Megan. You will discuss this when you're in your third trimester about your mode of delivery, and there is no reason why there shouldn't be a face-to-face consultation about discussing the pros and cons of the most appropriate way that you want to give birth.
Brilliant, thank you. She's also asked, Megan, how can I reassure myself that all's okay with the baby when I can't hear the heartbeat face-to-face appointments? And a few women commented that they just feel like they're being left to it, and obviously you rely on that appointment to know. And
I saw some comments a little earlier on in the week about ladies who were concerned that they went for their appointment at 15 weeks and they didn't hear the heartbeat. They went for an appointment at just after 20 weeks and they didn't hear the heartbeat. Now, this is nothing new in relation to what's going on in the NHS or within the world at the moment with the coronavirus. Listening to a fetal heart doesn't generally happen with your midwife until around 24 weeks. Now, this isn't generally new. This has been happening for a number of years now, but if you haven't had a baby for a long time, like me, then you will be accustomed to the midwife listening to your baby at 15 weeks. And one of the reasons that stopped was because at 15 weeks, when the pregnancy is so very immature, it can be quite difficult to be able to pick the baby's heartbeat up. And there were a lot of scenarios where we were unable to do so, and they were causing more alarm than not. So I now am coming up and I've just started to feel the baby move. Okay, there's no consistency there, and I do still panic like everybody does when I have 24 hours of, where's my knocking gone? Got no knocking today. And then the next day, baby's going absolutely bonkers. So generally when we get to 24 weeks, you will then see the midwife starting to listen to the baby. And we can say that women can experience their first episodes of fetal movement prior to 24 weeks. We expect by 24 weeks that women are starting to feel their baby move or have felt their baby move with some more consistency. So we can say after 24 weeks that, yes, the midwife will listen to the baby's heartbeat, but when you're replacing appointments then with a face-to-face consultation, we're not listening to the baby's heartbeat. But your midwife will ask about your fetal movement, and she will ask whether you are about the baby's movement. And this is a nice time to bring in about kicks count, and about especially at this current climate, that every woman that is expecting a baby should be aware of their fetal movements and the patterns of their fetal movements of when their baby generally moves. Years ago, we used to say any more than 10 movements, and I will be scorned for saying this, but there are still many women out there that believe if your baby moves at least 10 times in a day, then everything is fine. God forbid those words came out my mouth. We don't say that anymore, and the advice that we give is that kicks count, not count the kicks. So we are saying to women that become aware of what your movements are. You are the best person to be able to interpret the well-being of your baby over a long period of time, because you know what your baby does and how your baby moves. So become aware of it and monitor it. Monitor it. If you have any concerns, then please alert your maternity assessment unit and tell them your experiences so they can give you advice. Don't leave it. get the advice. And if the advice is to wait a couple of hours, fine. If the advice is to come straight down, then fine. But make sure you alert the correct people before you make decisions yourself of what you think would be the right thing. The other thing is home Dopplers. It may be a time that these businesses are going through the roof, because everybody wants the security of knowing if they can't speak to their midwife, they can't see their midwife, and the midwife's not listening in, then I'm going to buy myself my own little Doppler to have at home. We strongly suggest that women do not partake in listening to their baby's heartbeat at home. And there's a very, very good reason for that, because there have been many circumstances still to this day, no matter how clever you think you are of picking it up, and if it's double the rate, then it's definitely my baby. There are many circumstances of babies that don't make it, and devastated parents because they have relied on home Dopplers as an assessment of their baby's well-being. Remember, the golden advice is monitor your movements. If you're not happy, then nor are we. So call us, give us a ring, call the MAU unit and let them know that things are not great, and we can make a plan for you from there. But Megan, don't worry. As soon as you go back, I think for your next assessment for your fetal monitoring, was it Megan that asked that question? Yeah, it was. Because you looked down, I thought you were getting all puzzled. Yes, Megan, we've still got a long way to go, and still yet I haven't heard my baby's heartbeat, and I'm 20 weeks now. So when I see my midwife again at 24 weeks, I'm hoping then it will be the moment that we'll get to hear.
That's it. And the amount of times I had to ring my maternity unit because she wasn't moving and I was panicking, and it happens to everybody, and they would much rather say, right, come in. And then it's typical, the second you get there, your baby starts moving and you're like, why now when I've waited for hours for you to do this?
Mm-hmm. And your experiences when you've gone into hospital and you've got reduced movement, you'll probably remember that nobody listened in with a Doppler.
Yeah.
They put you on a monitor. Yeah. And they have a long period of time of assessing that baby's well-being. So that is a priority, to make sure that you're diverted to the right people that can do the right things and look after you. And everything's okay and everything's fantastic, wonderful. Absolutely.
That's expect to be safe and sorry, isn't it? So, okay, in relation to that, Jodie Lee asked, she was told she was breech at her last scan, but because she's not having her next face-to-face midwife appointment, how will she know if the baby's still breech? I mean, going from my own experience, Martha was breech until around 38 weeks, and they said, don't worry until it's time to be worried. So I don't know if that's the right advice to give, or if you can give any more information.
Well, we generally say that we expect, or would like, not expect, that's the wrong word, we would like ladies that are coming up to their 40-week mark for the baby to be head down, especially those that are going to deliver respectively vaginally. So some of them, however, have a different idea, and some babies don't ever present head down, but some of them can come bum down, foot down, elbow down, cheek down, chin down, wherever. You seeing or should be seeing your midwife around about 36 weeks, and it's generally at that time that the midwife will do a palpation. So a palpation being a little assessment of the baby's tummy with her hands to be able to see whether the head is up and whether the head is down. Sometimes it can be quite challenging. Babies can be difficult little things to be able to manipulate through an abdomen, and if there's quite a bit of mummy there, it can be quite difficult to ascertain position. And if a baby has always been to the pelvis, it can be quite difficult to really be quite secure. Is it a head or is it a bottom? So it's not always a 100% guarantee when the midwife does a palpation that it's definitely correct, even though we would like it to be. So the scan, I would assume that you've had, I'm guessing you're under 36 weeks, because otherwise you wouldn't be asking me the question, because they will already have told you. You may at the latest be 34 weeks if you've had a growth scan. You may be earlier than that, you may be 28 weeks. If you're prior to 32 weeks and you've I'm not even going to say 32 weeks because that's silly. If you're prior to 36 weeks and you've had a scandal and the baby was breech, don't stress. Relax, chill out, take a back step and don't worry about it. Now, we need to know prior to you going into labour whether the baby head or bum down. And there will be quite secure appointment schedules that the midwifery team currently will be aware of about when they need to see their ladies. Ideally, if we know a baby is breech at 36, 37 weeks, then we can put the wheels in motion for you to go to the hospital, have a scan to confirm it. If it is breech, we can discuss then, are you an ideal candidate for an ECB, which is where we can manually rotate the baby into a head down cephalic position, or is it best to discuss a different mode of delivery with you? It's a challenging one. A lot of people freak about it, and I still have people that I see at 24 weeks where the baby is breech and they have an absolute meltdown that, oh my God, will it turn? Will it be okay? It's absolutely fine. Don't panic. It's merely an observation of the baby's position at present, and babies move all the time. If there is plenty of fluid in there, then that baby will hopefully become head down when the time is right. But ideally, we are having a palpation or a scan by 36, 37 weeks by your midwife to ascertain position. Don't worry about it. I think you're probably a little bit early at the moment to start getting too concerned about the baby's position. In good time, it will turn. My first was breech. Little Finlay was breech right up until 36 weeks, and I was almost preparing myself for the table. It's going to happen and it's not going to turn. 24, and this was just on palpation, and then 24 hours later, when I went into work, I had a scan with some colleagues. I didn't know it was a boy, by the way, and I was confident he hadn't turned. The probe was put where we expected his head to be, which was right at the top of my tummy, and we were greeted with a beautiful pair of testicles and a very healthy little willy that confirmed the gender 4 weeks before the scan. So confirmed that the table was out now because I've got to go for this normal delivery. But all was quite funny in the end. And at 36 weeks, without me even knowing hours, it'd done a complete spin and I didn't even feel it. So keep yourself active, keep yourself upright, and yeah, this baby will, has got plenty of time. So no worry.
Most naturally turn anyway, don't they? And they told me I would really feel it when she turned, but I didn't have a clue. I didn't know she turned, I didn't feel it. So, but I was bouncing on the ball every day, and I was walking sideways up and down the stairs, and if you could have been a fly on the wall in my house, I was crawling around doing all sorts. But it worked, so.
Exactly. Okay,
we've got one last question from Alison. My baby is 5 weeks tomorrow. He's been constipated for the last couple of days, strains to poo, his belly feels hard, and when he does fill his nappy, his stool is almost hard, clay-like. Any tips to get his bowels moving again? Yeah.
So the first thing that jumped 5 weeks old, has been bottle feeding. It doesn't say whether the baby's always been bottle fed, but the baby's, is that right? Baby's always been bottle fed? Or baby is bottle fed?
He's bottle fed, yeah. SMA organic and takes 4 or 5 ounces every 4 hours or so.
Okay, fine. Okay. So the main thing that jump usually with constipation is changes to the diet. So I would want to know whether this baby has been dual feeding, maybe with the breast and the bottle for some time, and then now has switched over to bottle. Has there been a change in the milk that the baby has had? Has there been a change in the pattern of the feeding that the baby has been having over time? All of a sudden increase with more of a consumption than what the baby was having before. The other thing is dehydration. So is the baby drinking enough? 4 ounces, 4.5 ounces every 4 hours. Is this being what the baby has been used to over the course of the last few weeks, or have you noticed that the baby has not been drinking as much? what is the baby's weight? Is the baby on normal parameters with what it's been feeding? So they're the major things that I would say we need to look at from sort of a helicopter view before we start thinking about any remedies. So let's not get too excited. Everybody has a bit of constipation at some time, and babies are renowned for their poo for days. So they would probably recommend are making sure that the baby has a little bit of a routine in the evening. For example, a warm bath. After the warm bath, a massage in the tummy area with circular motions. You can download gentle baby massages on YouTube. They're easy to be able to see. You can purchase apps, but you don't need to go to the expense of. Visualizing other people massaging their babies is quite normal, and it's quite a safe thing to be able to do, is to keep your baby nice and active. The bicycle movement of the legs, nice and gently after the bath, will be able to exercise the gut and the bowel. We also say that when babies are over, I know this baby is only 4 weeks old, there are lots of sort of old wives' tales Granny Annie used to do, and Sheila down the road used to do, like introducing sugar into a bottle, or giving babies a bit of pureed fruit from quite an early age, just to try and get the bowels moving again. It isn't necessary. We can say from 4 months onwards that you can introduce a little bit of cool boiled water for hydration purposes, but however, this baby is 5 weeks old. Bright water you can use sparingly, but do read the instructions on the back about when you can introduce it. But most definitely massage, most definitely think about the history of the feeding, think about the hydration, is the baby having enough? Think about massage, keeping the baby nice and warm and comfortable, and making sure that you well birth the baby afterwards. Now, we don't want to see babies distressed. If there is blood in the poo, or if the baby, you're really concerned about it and we're beyond, a clear number of days, the baby hasn't passed, the baby really is straining, and you can see that this really is a potential problem, and you've exercised all of the things that we've spoken about already. The baby is losing weight, or is appearing lethargic or tremendously tired all the time. This is you probably need to get the GP involved as a matter of urgency for an appointment, to make sure there isn't anything outside of the normal expectations of constipation that we're not covering. Because even though constipation can happen to most babies, and trap wind can happen to most babies, it can also be a sign of other things. So make sure that you cover all of these things beforehand, and if it's still not working and you're still really struggling, then get some support.
Perfect. Right. Does anybody else have questions while we're live, or?
Not difficult ones.
You've not had time to pre-plan.
That's opening the gates.
Everybody's commenting. If anyone does have any comment on here, comment on the other post from the frequently asked questions post, message myself, message Katie, anything. We're happy to help, and we'll go from there.
Yeah.
But the next online class is on Sunday. That's with Isabel Jordan, and she will be doing the live antenatal class. So if you want to tune in to class 12 on Sunday, we'll be doing exactly the same as this. I'll be answering questions for her, sat in the corner here, and she'll be on the big screen doing that. But thank you so much to everyone that's joined. There's been a lot of people, and thank you, Katie, for.
Thank you very much. Well, it's absolutely fantastic. I think it's a wonderful group. I'm following it avidly, so when you do put your questions on, I may very well be responding from my personal Facebook, just with some guidance advice. But if there's anybody that's got any burning questions that they're really, really worried about, then please do send them as a matter of urgency to Jade, and we're in constant contact, so I can follow those up as quickly as possible, and not any of this silly 2 to 4 day turnaround. I am hot on the press all the time. And a ball, that's what I am. I need things to do.
I think we're all in the same boat, aren't we?
5Ks, I'm about halfway through it. I'm not doing so I might have a bit of cake this evening now, and congratulate myself on this wonderful opportunity to share all of these wonderful pieces of advice. But thank you very much, it's been fab.
Brilliant, thank you very much. Bye everyone.
See you later, bye bye.